Thank you very much, Rachel. Some of you may note that we're going to change the schedule around a little bit. We're actually not taking a break right now. We're going to go right into Liz Baxter, who I hope is ready. Liz Baxter has spent her career in health and health policy, building bridges between the public and policy and decision makers. Currently, she is the executive director of the Oregon Public Health Institute. Previously, Baxter was executive director of We Can Do Better, an organization that believes in the power of leverage, that small groups of people can have great impact. She also worked for the state of Oregon, overseeing a Health Resources and Services Administration state planning grant that identified strategies to expand coverage to uninsured Oregonians. And for Legacy Health System, where she administered grant-funded research in managing high-risk patients through chronic care initiatives and care management strategies, connecting traditional medical care with community-based supportive services. Baxter currently chairs the board for Cover Oregon, Oregon's health insurance exchange, and serves on the boards of Oregon Health Decisions and the Mackenzie River Gathering Foundation. Nice name. And for those of you who have questions for Rachel and then subsequently for Liz, you have cards. If you would pass those to the center aisles, people can collect those. So, Liz Baxter.
So since we've scheduled, I'm the person between you and a break. So I'm going to try and stay to my remarks. I have them in writing because otherwise, as my boys would say, it takes me 5 minutes just to say hello. I want to start by thanking the Colorado Health Foundation for the opportunity to be on such an amazing panel. And I have to tell you that in a room where there are this many people, typically I'm the person who has brought the questions into the room, and I'd be asking stuff of you. So very challenging for me to be at this end instead of at that end. And I do want to say that my remarks are additive to the panelists who have come before me. As Tony said, I have spent most of my career in what I refer to as the spaces in between. So in between policymakers and people who are impacted by the decisions that are made and sometimes the decisions that are not made. And after hearing that introduction, I actually am reminded of a story that is one of my boys. So I've raised 3 boys into adulthood, and that by itself is probably worth its own introduction. So my middle son was a soccer player and is still playing soccer, and I was the proverbial soccer mom. So I would be in the minivan, and I would have 6 or 7 boys in the back of the van, to and from practice, to and from games. And one night, we were driving by the billboard, and I don't know if you have those, that say, you know, the mega bucks is like $357 million. And these boys started talking about what would they do if they won this lottery. And my son says, well, you should hope that my mom doesn't win, because she will just give all of that money away to poor people. And so his friends say, well, what does your mom do? And Tyler says, my mom is a nurse and she works at a hospital. And as you can imagine from that introduction, I am not a nurse. So we drop all the boys off, and now it's just me and Tyler in the car. And I say, you do know that I'm not a nurse, right? And he says, yes, but it is so much easier than trying to describe what you do. So, I want to tell you a little bit about OPHI before I start. We are part of the National Network of Public Health Institutes, and Colorado also has an institute that's part of that network. We work with local, regional, and national partners on issues that are health-focused in communities around our state. We incorporate community members in all of our work, whether it's about food, and that be retail or nutrition. It's about low-income housing, transportation, green spaces, parks, worksite wellness. We have a belief that we actually cannot do enduring, long-lasting policy change without including people who are impacted by those policies. And I was heavily impacted by 3 people that I want to mention. 2 were actual nurses, nurse researchers from the Oregon School of Nursing, Pat Archibald and Barbara Stewart. And many years ago, we were both working on projects that were around caregivers of people with Alzheimer's disease and other dementias. And they had just published an article that was very academic, but it still stuck with me. And they were looking at what were the care management models that actually had the greatest impact on families who were dealing with dementia. And they said that the models that were most effective combined what they referred to as colonial knowledge and local knowledge. Colonial knowledge to them being the information that professionals bring into the room about all of the resources that are available out in the community. And the local knowledge being the information that families have about what the support system is like, what times of day work best for different things, what are the resources that are already at play. And when you can bring those 2 bodies of knowledge together, you come up with something that can actually change the trajectory of how that family is doing their work. And I've carried that with me with the work that we do around community engagement. The third person is Michael Garland, who is one of the co-founders of Oregon Health Decisions, where I've been on the board now for almost 10 years. And for those who do board work, you got to really love an organization to stay for 10 years. And his belief is that community engagement on an authentic and genuine level is really what sustains policy change. And so Oregon Health Decisions has been a part of some of the massive, large-scale policy changes across Oregon. So words matter. There are a couple of assumptions that shape the work that we're involved with in Oregon. The first is, before people in communities can actually engage with us, they need to be better informed about the policy issue that's at hand. They need to know, what is this thing that we're talking about? Secondly, they need to have a better understanding of what's the question or the issue that we're trying to get some feedback from them on. What's the debate about? What's the discussion about? And 3, it has to be in a language that folks can understand. And so I want to be really clear, I'm not talking about dumbing down. I'm not talking about leaving out technical information that's really important. But I think that it is our job as policymakers to make sure that we can speak in plain speak, because it's not the responsibility of people in our communities to learn policy speak. That's just not going to happen. So how we figure out how to speak in a way that anybody can understand what we're talking about, that's really part of the job at hand around community engagement. I feel like I'm in about 1st or 2nd grade at doing that, but that's our task. So these 3 words, they come up for me every day, all day. They are an example where people in our community use these 3 things interchangeably when they're talking about the work that we do. They are different. Different strategies are at play if we're trying to impact one or the other of those. And I'm going to kindly say, even my friends in the media use these 3 things interchangeably, and it confuses matters. So it's really important for us to just know which one of them are we talking about when we're going out and asking communities or working with communities to engage in a conversation with us. So I have a question for you, because I just can't not ask you questions. So how many of you in your day job are somehow related to health, healthcare, health insurance, health policy. Almost everybody. So here's one of my very often quotes in Oregon. I think there are about 350 people in Oregon, and we're a state of almost 4 million people, who understand the language that I speak every day when I'm at work. And I can put my family to sleep easily in 2 to 3 minutes. If they ask me, so what did you do today? And I try and tell them anything about that conversation. Community members, their big issues, jobs, the cost of housing, kids in school, the rising cost of food, they speak a language that we need to figure out how to communicate better with them. And so this is where I could become very, very envious of Colorado. And one of the things that I heard on our planning call, which I told Neville that we've been like quoting this all week. He said that in Colorado, you've kind of gotten beyond the politics of the Affordable Care Act. And I said, wow, then I'm coming to Colorado and I'm not leaving. So my question to you, and this, you probably don't have to raise your hand, but when you pull in your driveway at the end of your workday, and let's just say your neighbor is outside, and your neighbor says, hey, how was your day? I'm curious how many of you actually talk to them about the work that you did during your day. For me, I know that I don't. I typically will go, let me think of something about kids, dogs, yards, neighbors, something that's happening, because in that instant, it is very hard for me to translate into a way and in a meaningful way that they will understand. So my older son, and he didn't get this genetically, speaks Chinese and Korean fluently. His wife is from Korea, and she also speaks Chinese and Japanese and French. And I really just get down on myself quite a bit for the fact that I cannot get beyond hello and thank you in Chinese and Korean. And so one day I was kind of complaining about this and saying, why don't I have that ability? And he says, but Mom, you speak 2 foreign languages. You speak healthcareese and bureaucratese. And it really kind of gave me, again, this epiphany, because it means that part of my job is to continue to translate that information in a way that folks who don't speak that language can actually understand. So what are the real reasons why people come out? And we've boiled them down to 3. And it's that they're either protesting, they're advocates, or they really think that somehow we're going to be working together in collaboration with them. So luckily for you, most of my slides you don't have to take notes on. But I have some images that I'm sure are familiar, whether you've seen them nationally or you've seen them right in your hometown. So people protest. They usually do it because policymakers, we, did something, made a decision that they just had an emotional reaction to. It pissed them off. They're going to march on the streets to tell us just how pissed off they are. Certainly the Affordable Care Act debate brought out many people who were protesting about the process and the decisions that have been made along the way. But at the same time, even this level of engagement can be a very rich process. There's always the possibility that there's somebody in this crowd who has that light bulb idea that they've reframed something in a way that we hadn't thought about before, and so we've got to have our ears open. But it requires something from us in order for that to happen. It requires that we are listening to what folks are saying when they're protesting, that we hear them, that the information that we hear has some type of a receptor site, so that if we hear something profound from them, we actually can do something with that. They elevate issues, they raise awareness. The protests in our state led to Oregon having 2 co-ops under the Affordable Care Act, and I'm not sure that we would have done that if people weren't protesting about privately funded insurance and it wasn't meeting their needs. But it also gives you an opportunity to look for who are potential leaders in communities that you can reach out to when the next time that an issue comes up. You look for the folks who are thoughtful, who really want to engage, and who know other people in their communities that can help us get beyond that first layer. Then there's advocacy. Usually these are community members who actually have some ideas for change, something that they're bringing to the table, that they're willing to urge and do the work and bring folks together to kind of work together on an issue. Might be about, we're losing mental health beds. There's no place for taking folks other than going to jail. It might be that it's about low-income housing and subsidies. It might be about anything that's happening in your community. But advocates are a rich resource in our communities. And engaging them, whether those folks are paid advocates or they're volunteers, give us a way to have a further reach out into communities and allows us to bring their experiences, their expertise, their perspectives into the policy discussions that we're having. And so as an example, and this is one of the things that I just hold on to, I think of the folks in Oregon who make decisions around Medicaid policy. And what I know, there's hardly anybody who has ever been on the Medicaid program who is making Medicaid policy in the state of Oregon. I would imagine the same is true for Medicare. Now, when we get to some other issues like housing, mental health, behavioral health, very often you'll have family members who are also professionals who bring some of that to the table. But it's important for us to understand we can't have sustained change making decisions on behalf of people. We have to figure out a way to make decisions with folks. Whoops, went backwards. So collaboration. This is where you find the opportunities to find common ground, but it really has to be done, I'm going to come back to this, with authenticity and genuine commitment. Because for me, if I don't feel like I'm being listened to, I'm both going to go somewhere else, and I'm probably going to amp up my emotional level, and I might end up being that advocate or that protester the next time. What it means for us is moving away from the traditional way that we do meetings with the public. And so I've not been to a public meeting in Colorado, so I can't speak for this. So again, I'm going to speak from Oregon. Typically what would happen, let's say that the Department of Human Services is going around the state describing its budget process. They schedule 2-hour meetings in different communities around the state. Somebody who is a state officer will spend 40 minutes or so going over the state budget. There'll be a microphone in each one of the aisles. Folks can ask questions of this person who's, up there on the dais. And instead, what we would like to propose, and it's what's worked really well for us in Oregon, that our job is not to be up here as the experts. Our job is to figure out how to frame the issue and the question in such a way that you're the experts. The people that are in your communities are the experts because there's something that you need from them that only they can give you. And when you can reframe your engagement, even around kind of very dull and boring policy issues, you get something very rich. And you also get communities who feel like they're a part of the decisions that are being made. Decisions are not being made for them, and all they get to do is react to it. So there are 3 reminders for me always. One is that no matter what the policy issue is, there is always something that in the back of your mind or the forefront of your mind, you wish you knew how the community felt about X. My encouragement to you, find a way to ask them, because you'll get something very rich in return. The second piece is to ask your questions in a way that no matter what someone says to you, that information is useful to you. That's harder than it sounds, because it means that we have to get our questions right before we start thinking about where should we be going once we move on down the line. And the third thing is once you get information and feedback from a community, whether that's formal or informal, that you have some circular loop of going back to those communities and telling them, here's what we heard, and here's what happened with the policy decision because of what we heard from you. Those 3 things are my constant everyday reminder. And the fourth one, which I didn't write down, but I probably should have, I think it's incumbent upon us to be aware of who's in the room giving us input and who's not in the room that we need to do a better job of reaching out to them. And so I think of the LGBTQ community, seniors, people with disabilities, veterans, people who are homeless, Native American and tribal members, that sometimes they just don't show up for these, like, we're hoping that you're going to come and help us. That's not because they are hard to reach. It's because I didn't do my job in figuring out a way to connect with them, and I need to be able to take responsibility for that. And it's not as hard as it sounds. So there are many strategies and great folks around the state and around the country who can help with that kind of outreach. So I have a couple of examples to use, and there are many in Oregon that are around public input. We have open meetings laws. We are a state that believes that you have community meetings about everything, and I mean everything. So, but I thought about Oregon's Death with Dignity law, was on our ballot twice, went to the Supreme Court, and each time Oregon's law was upheld. And it was upheld because there was a robust, almost 2-year process of engaging with people around the state about what it meant to allow me to make my own choices as opposed to anybody else making choices for me. The people's voice carried the day for that. But the examples I want to use are just more current than they're kind of more about healthcare. So in 2003, Oregon was facing a massive deficit, and we are a state that constitutionally is mandated to have a balanced budget. And so the Health Policy Board that oversees the Oregon Health Plan, and in Oregon, the Oregon Health Plan is our Medicaid waiver that in 2003 was probably about 10 or 11 years old, where people are on Medicaid because of their income level, not because of the categorical eligibility. And so it was very popular. It kind of created a level floor. Even if you didn't like where the floor was at least level for everyone. And the legislature said, we're thinking about letting go of our waiver. And so the Health Policy Board said, oh my God, we need to find out how do Oregonians feel about the Oregon Health Plan. And so the Health Policy Board came to me and they said, will you help us do a series of meetings around the state so we can find out how people think about the Oregon Health Plan? And my response to them was, so if I come back from all of these meetings and Oregonians say, we love the Oregon Health Plan just the way it is, please don't change it, what will you do with that information? And it forced kind of a dialogue where they were able to say, here's the question that we have at hand. It was, we need to find some general fund revenue. The way that we're thinking about doing that is either incorporating premiums or co-pays, because that's the only way that we don't end up cutting people from the Oregon Health Plan. And we said, our team said, we can find out from you which one works best for low-income folks around the state. We did 12 meetings, probably had 1,500 people who came to those meetings, and at the end of those meetings, we were able to give a report to the Health Policy Board that said, overwhelmingly, there is consensus that a income-based premium will work better than a point-of-service copay for people who are on the Oregon Health Plan. And that's what they did. And to this day, that has not changed other than one tiny piece, which was that there was actually a $6 a month premium instituted for people who were at the zero income level. We were able to get that one taken away. So the second one is really our early days of talking about health reform in our state. And that's where this organization that was formed called We Can Do Better came into play. It was started with the person who's now our governor, who at the time was our former governor, John Kitzhaber. And what he wanted to do was to see, could we do a statewide education and engagement around health reform so that Oregonians would understand the difference between health, healthcare, and health insurance. And so for about 8 months, we traveled the state. We did community meetings. We met with business leaders, health system leaders, nursing leaders, labor, employment, small employers, just to talk about, could we shape a set of principles that should guide any of our health reform decisions moving forward. We had started with a list of 10 draft principles. By the time we got to the legislature looking at legislation, we were at 15. It was the early days of blogging websites, and so, I got to be a technology geek really quickly. There were about 3,000 people who gave input on this set of principles. Every one of my gray hairs is probably at least 10 of those people because I got to incorporate all of that input. And what we committed to We're not going to put this set of principles before the legislature until people stop commenting. So when folks said, I guess that's okay, we went ahead and we put that into the legislature as a bill. And so the bill that eventually passed has these 15 principles embedded in it. It is what guides all of Oregon's work, and it makes a difference that people around the state, rural, urban, Democrat, Republican, they all felt like they had their fingerprints on this set of principles. They knew what they were trying to move towards. It's one of the reasons that Oregon adopted Berwick's triple aim in order to guide its work, because we said we're all about getting to better health. And we had people around the state who were there with us. So which takes me to the Post-Affordable Care Act. I have the amazing honor of chairing the board of directors for our insurance exchange. Is there anybody in the room who's never heard of Cover Oregon? I was kind of hoping I was in like a fresh audience, but because of all of that engagement that we had done, inside of our state, people are still kind of like, we know it's been kind of messy. Yeah, we know the technology kind of didn't work, but we like where Cover Oregon is going. So the irony for us is that we do not have the hatred and the vitriol that we get from the national media. We do not have that internally in Oregon. And I really attribute that to the fact that we engaged communities around the state, from high income to people with no income, communities of color, people who were doing work on the ground in their communities with, here's what we're trying to get to. And so probably my darkest day was the day that John Oliver decided to do a clip about Cover Oregon. And what he said at the end of the clip was, with all of this work, Oregon has not enrolled one person in their health insurance exchange. Love Jon Stewart, I actually kind of love John Oliver. And I said, isn't that incredible? Because as of yesterday, we've actually enrolled like almost 300,000 people. We did it despite the technology. And the only thing that folks want to know at the national level, how many people have enrolled through your technology? So in Oregon, we're almost at 500,000 people who've been added to coverage since January 1st of this year. Inside of our state, people understand the complexity, they understand the trade-offs that have been made. That would not have happened without robust, genuine community engagement. So I'm going to end with two quotes. And I am very much looking forward to the discussion we have after the other panelists and the break. One is Abraham Lincoln. With public sentiment, nothing can fail. Without it, nothing can succeed. If you believe that, it means much more than the times when somebody would come to me and say, Liz, we'd love for you to be on our planning committee because you're a person of color, you're kind of really smart, you're a lesbian, and there's this friend of mine that refers to it as intersectionality. If they can find like 3 or 4 things in one person, they're gonna pick you. And so I said, boy, if you're only going as far as me for people of color, you have not gone far enough. And just being very clear with that. The second is from John Kitzhaber, who is a friend as well as now currently our governor. And this is a belief that he has had for many, many years, that the problems that we face are about us. If we want to get to solving climate change, if we want to talk about fossil fuels, I've only been in Colorado for a day and a half. I know a lot about the political campaigns and what your arguments are about here in Colorado from your commercials. If we're going to solve any of those, these are not going to be solved by the political process. They're going to be solved because we work together as people in our state and we make sure that nobody is left behind. And so we're not going to solve them unless we do it together. And so those are the beliefs that I carry with me when I think about community engagement. And I thank you all very much and look forward to the discussion.
Wow, that was awesome. Okay, well, thank you, Liz. And you know, I'll just have to say that that was one of the most thoughtful and kind of insightful analyses of community engagement I've ever heard. I really appreciate that. So now we're going to take a break, and I think that this is time they're going to reset the stage or something. But if you have questions for the first three speakers, I guess for me too, write them on a little card and move them to the center aisles, and somebody somewhere will be collecting those. 15-minute break, and then we'll come back for our final two speakers.
To put people first is a really core concept, and probably the central one at this new way of thinking in terms of trying to have healthier buildings and healthier cities. So traditionally, we've built our cities for the car and for speed, and we're trying to shift that over to give people actual choices. The economic value of investing in healthy places is that you're increasing the value for residents, for businesses, and for the city generally. So we're on a residential green roof. This is a really great example of using built form and green space to make something more amenable, and generally in spaces that you can't tear a building down and put a park in there, it's just not going to work, but you can add green space like this to make the city more livable. So being creative about adding green space to your city can have benefits not only for the image of the city in terms of promoting itself as green. It can help office workers, and it can also help residents to have more access to green space they might not have in downtown urban areas. At a citywide level, it can do a huge amount to clean the air, reduce the urban heat island effect. Traditional benefits that we viewed as soft and really nice to have but not really necessary, in fact, have very real economic value. And part of the goal of what we're trying to do is to put an economic value on those. The way to empower local grassroots champions for health is to first invite them to the table. Inviting them to the table and having policy in place to allow them to do that really means that the outcomes are much more likely to be successful. So the way to energize shared spaces is to really think, instead of only thinking about what are our destinations, thinking about what is the transition between those nodes.
So here at the Mariposa District, we were being really smarter and more intentional about improving health outcomes and the quality of life for the residents, all residents here in the Mariposa District. So this is a great place to see so much of what makes Colorado and the city of Denver great. From right here inside our interactive stairwell.
We are transforming the stairs from a fire exit stairs into a musical instrument, an educational tool. And this is, by nature, it's an exercise equipment. This is also Mariposa, this is Butterfly, as the stairs has transformed from an exit stairs to something artful and beautiful.
The interactive stairwell, the gardens, and the walkways around the buildings. All that's designed really to get people to consciously live a more healthy lifestyle. It also makes, as we say, the healthy choice the easy choice, so that you can walk, you can choose to grow your own vegetables and have a place to do that. The built environment is really the things that you don't think about every day is if you're a resident in a community, but it's the things that have an impact on your everyday life. Just behind me, across the street, is the 10th and Osage Light Rail Station, as well as a bike share program, a B-cycle station. So it's really giving people many more opportunities in terms of how to get around.
So the way to ensure equitable access to areas and to amenities is ensuring, as I said before, multiple choices and really real choices for different modes of transportation. Develop housing for young and old alike. Mix it up.
Hi, I'm Ken Mark Wharton. I'm an ambassador for pickleball in the Denver area. and I'm also known as Pickleball Ken. Pickleball is a little like tennis, only smaller, a little bit like ping pong, only bigger, and it's a smaller court, and it's good for older people that have joint replacement, and then they can play, and it's such a popular sport. It's the fastest growing sport in North America. We started with 4 people in Westminster 3.5 years ago, and it's just grown because of it's such a great sport, and it gets people off the couch and they become can-do people instead of can't-do people. Since we built the 8 pickleball courts, we've had people come from as far away as Fort Collins, and so it literally becomes a pickleball community.
A lot of my time is dedicated to these courts and to the community out here because we have so many people that Ken has brought into us. So all these people coming over, like Ken said, from Fort Collins, Colorado Springs, Aurora, everywhere, they just want to get out and play. And since we have all these courts and we're eventually going to have 16 more, that's my goal, is just to fill these courts and make sure everybody's happy and having a great time.
Embracing the unique character of areas that you're trying to redevelop or develop is really important in terms of creating something that people want to go to. If neighbors sun themselves on a creekside beach, connect the beach to walking and biking paths. Ways to promote access to healthy food choices are to promote farmers markets in areas that don't have farmers markets. Community gardening is a really great way, especially ones that engage different segments of society. Make it active. And there need to be ways to really encourage green space areas that, first of all, encourage activity, but also make those accessible. And part of that is understanding what kind of green space we value in the city and how we value it being used. The way cities are built is not inevitable. It doesn't just happen. These are specific decisions that are made, and we need to be able to recognize how can we make workable urban environments that encourage health, active living, and healthy eating.
I think the biggest takeaway is really the authenticity of the engagement and to what end that you're engaging different audiences and communities. And I think having sort of the clarity of why you're engaging folks and to what end is really important for bringing different voices to whatever solution you're trying to advance. It's not just a question of looking at healthcare solutions, but the different types of issues. The different types of issues that intersect with that affect our health, whether you think of income, education, where we live, our neighborhoods, all those different types of things that really affect our opportunities to be healthy. I think it reinforces a lot of what we've been working on over the last several months, particularly with our health equity advocacy work and populations and communities that affect that are affected by health inequities themselves, and really bringing their voices to the policy. To the policy process and adding them to the way we advance those solutions.
We're always striving to do better at what we do, and I think that certainly in the broad context applies to how we work to help Coloradans be healthy, but it's also about developing the right relationships to achieve your objectives. And if you can really foster those relationships to help them grow stronger, I think the work grows stronger as well. We are just doing so much with so many partners that are at this conference and those that aren't at this conference to really make Colorado the healthiest state. But we really need all the people at the table. I hesitate to even name the kind of key partners because there are so many, but certainly the patients and the consumers that receive care, we want to provide them with whole person-centered care and really help them to achieve their health and social well-being goals.
No matter what path you start on, you end up at this place. And the place is that we're getting really, really good at producing data and producing reports at this point, but how you disseminate those and how people actually decide to do something differently is a whole different animal. It's a whole different endeavor. And it turns out that there's been a lot of research done in neuroscience, which basically says that we are hardwired in our human brains to relate to one another. So trust, relationship, all the stuff that we used to think of soft science, turns out that it's actually hard neuroscience that you can actually see light up on functional MRI. I actually started as the chair of the steering committee and the first chairman of the board of Civic a few years back. And I remember consumers coming to those meetings and saying, you know, we want to know what the plans are, and not when you're ready to deploy them, but as you're planning them, we want to be involved from day one. And we said, okay, rule now is that we'll have consumers on every committee from the board on down, you know, all the time. And I said, so, you know, you have our word on that. And they said, yeah, we heard you say that. I said, so the problem would be? And they said, we actually don't believe you. I thought, okay. Well, that's perfectly natural, right? Didn't know us, didn't know basically how the operation worked, and so it became our obligation basically to let them know that we were serious about that, and that's what we were going to do because we believe the same things that they did. There's some things you can that you can't really accomplish unless you behave in that way. And reforming healthcare, you know, 27 million stakeholders, a gazillion different points of view, it's impossible to get it done unless you have the trust of the people that you deal with, including the people who don't disagree, who don't agree with the way you want to do it.